Lisa, who's got more now on this disease.
Well, Jimmy, Rose seems really passionate about getting the word out about this disease, and for good reason. The Coalition for Pulmonary Fibrosis reports 40,000 people die each year from IPF, the same as to breast cancer. Now, the Coalition reports 2/3 of IPF patients pass away within 5 years of diagnosis. Now, there is no known cause, no FDA-approved treatments, and sadly, no cure for IPF. So knowledge on this disease is key. Here to break it down for us is Dr. Yashvir Sangwan, pulmonary specialist with Peninsula Regional Medical Center. Thanks for joining us this afternoon. So you heard Dr. White.
Yes.
So what do you think?
Well, a lot of points were brought up about this disease, all right? Now, if you take shortness of breath and cough, many people who come to primary care doctors have those symptoms, and not everybody will have IPF.
Right.
Now, if you are less than 45 years old, your chance that your shortness of breath is because of IPF is 1 in 30,000. But if you are greater than 75 years old, the chance is 1 in 500. So it's not that rare of a disease.
Right.
It's a disease of the elderly.
So it's a very complicated disease, very complex, right?
It's very complex because when you look at lung scarring in general, you are talking about 150 plus diseases, okay? Now, IPF is just one of those diseases. So if you look at 500,000 people in the United States who have lung scarring, around 130,000 actually will have IPF. Okay, and I do suspect that most of them are diagnosed on the basis of X-ray and not on the basis of a pulmonary consultation, where we make sure that they don't have any other reasons of having disease that look like IPF.
So because of that, a lot of times it's diagnosed too late, right?
Yes, it's often diagnosed too late, and the reasons for that are very easy to understand. Okay, now if you are 75 years old and you have some shortness of breath and cough, living in America, most likely you are overweight. Most likely you do not move much. Okay, and so you say, I'm short of breath, so what? I'm 75. That's what it's supposed to be. 6 months later is the average time that you actually go to a doctor. Okay, and you say that I'm having cough and shortness of breath. These are such non-specific complaints that the doctors usually will treat you for community-acquired pneumonia, asthma, emphysema, okay, before they start thinking about IPF. And even then, most of the IPF X-rays can look like heart failure. And when you listen to the lungs, they crackle. Okay. The reason they crackle is because these lungs are hard, they are not soft, they are scarred up. Okay, so with every breath they are like sandpaper. Exactly the same finding that you'll find in heart failure. So most of these patients actually end up going to a cardiac doctor before they come to us. By the time they come to us, the X-ray looks completely different.
And
you have that X-ray.
We saw one, and then take a look at that. That looks totally different.
By the time, it's already 2 years since the symptoms first started, on an average, when they look at it. When you come with those symptoms, with that X-ray, I can't do anything for it, because even if you have other causes that makes the X-ray scar up like that, which are treatable, okay, being on medications, having connective tissue disease, working in chicken farms, for example.
So many
of the other diseases that I could have stopped, okay, in their track by finding out what the reason is and treating that reason. You have not given me the opportunity to do that.
Right, so you have to really know what to look for in the X-ray. You have to be looking for it, really. Let's talk about risk factors. Are there any?
No, because the very fact that you call the disease idiopathic pulmonary fibrosis is because idiopathic means you don't really have a cause, okay? But that diagnosis should not be made on the basis of an X-ray. So many people will have scarring on their X-ray and the doctor tells them this looks like IPF, it has exactly the same distribution, okay, in your lungs, and we can't do anything for you. And you should fix your things up and prepare for death in maybe 2 to 5 years. But that might not be true, because IPF is not just X-ray, it is also a clinical diagnosis, and you need to come to a specialist. You need to spend at least 1 hour or 2. Most of my patients with IPF, they get that time. Why? Because it's very intricate detective work.
Right.
And I have to go back 10, 20 years, look at all the X-rays, see the progression, to find out whether this is actually IPF or just a mimic.
Okay. All right. Thank you so much. Such good information. Of course, knowledge is key. And if you would like to learn more about it from PRMC, go to delmarvalife.com and click on the show tab.